Delivery. So, may I move us now, please, on to item 8 on the agenda, which is the corporate and performance report. Matthew, can I ask you to kick off, please?
Let me first follow yours and Simon's words by just paying tribute to the NHS Emergency Services staff who responded with their usual professionalism last Wednesday, and particularly to the ambulance and paramedic staff and the staff from St Thomas's who came onto the bridge to care for injured people, and to those at Tommy's, King's, Chelsea and Westminster, St Mary's and the Royal London who took patients from the incident. I think it was another example of the NHS at its best. Looking at the performance for January, A&E attendances in the last 3 months have fallen to a growth rate of 1.7%. So over the year they're up by 3.3. Over the last 3 months, that rate has been 1.7%, and they're actually 1% lower than they were in January 2016. So that's the first time since April 2016 that we've had a month-on-month fall. Emergency admissions were up by 1.5% in January 2016, up 3.3% over the past 12 months. So I think there is some good news in there that we are seeing demand growth moderate as the urgent and emergency care strategy starts to have an effect, as primary and community services are going the extra mile, and as the public are working with us to access the best services for their needs. Overall, A&E performance against the 4-hour wait standard fell to 85.1% of people being discharged and treated within 4 hours, which isn't an acceptable position. Of the third of those people who attended a minor injuries unit or a walk-in centre or an urgent treatment centre, 99.4% were treated within 4 hours. So it shows that it's both to the benefit of patients and the NHS as a whole for people to use the right facilities and use urgent treatment centres when they can, which is why in the urgent emergency care plan for next year, we will be enhancing 111, we will be developing urgent treatment centres, and we will be introducing streaming within A&E departments to ensure that people get to the right care. In terms of delayed transfers of care, there was a small increase in the bed days lost to delayed transfers of care in January to 197,000 bed days. That's the equivalent of an average of 6,356 beds lost each day from appropriate NHS use. That's up 23% on the previous 12 months. So this is a significant issue. We have seen an 191,000 bed day increase in the NHS delays. That's a 17.5% increase, and a 209,000 increase in the bed days lost to social care delays. That's a 39% increase. So in the coming year, there's going to be a very significant focus on the NHS improving its discharge management and reducing its delayed transfers of care. And it's really crucial that the additional funding from the budget that's gone into social care is used in part to ensure that patients who are stuck in hospital due to an absence of home care or care home places get access to those services, because we know it's important on a whole host of areas. It's important for the patients themselves. These are usually elderly people who are having their liberty constrained and spending too long in hospital rather than being in the most appropriate place for them to enjoy their older years. It's important for patients who are in A&E because it's one of the major reasons why people aren't getting through A&E and admitted to the bed that they need in hospital, is because that bed is filled by somebody who should be being cared for somewhere else. It's important for people who are waiting for surgery because we're cancelling operations because there isn't a bed to put that person into. And it's important for the finances of the NHS, because trying to run a hospital at 95% bed occupancy or higher is not an efficient way of running the services. So on all counts, this is a really high priority for us next year. 111 answered 1.27 million calls in January. That's 45,000 more than January 2016, and over 88% of those were answered within 60 seconds, which is better than December the month before and better than January the year before. So as we go forward, we're trying to put in place the set of actions around urgent and emergency care which will turn the corner on performance and see that going back up to the standards that we expect, and will be a big focus for next year. So clearly freeing up bed capacity, both social care discharges and NHS discharges, to try and get the 2,000 to 3,000 beds back into use that are currently have social care patients in them. Managing demand, so standardising urgent treatment centres so that they are uniformly consistent in the high quality care that they can offer and the services they have. Supporting care homes to manage patients better so we get fewer patients admitted to hospital from care homes. Increasing the clinical support within 111 so that when you ring there, your chances of getting to speak to an appropriate clinician and therefore avoiding having to go to a GP or avoiding having to go to A&E will go up, and the front door streaming that I talked about will all be targeted at recovering our A&E performance. In other areas, we've seen the referral to treatment has been at about 90% for the past month of people seen and treated within 18 weeks. That's a small improvement on December. We've seen cancer hitting 4 out of 5 of the cancer standards, so the focus in the coming year will be getting the 62-day standard back on track and where it needs to be. And we've seen all 3 standards for access to psychological therapies continue to be being hit. So I think there's some really strong performance in there, but we really need to get our focus on emergency care, the right people in hospitals, and getting flow back into the system so that people get the right care in the right place. Thank you.
Thank you, Matthew. I think it's conceivable that the delivery plan tomorrow may have some things to say on those critical areas.
We may have some words on that subject, yes.
But let me just invite questions to you from Michelle.
Thank you, Matthew. Local authorities have been experiencing quite significant financial pressures. How do you plan to work with local authorities to ensure that the funding on social care really benefits citizens, as you say, who are inappropriately delayed in hospitals?
Yeah, I mean, there's no question that local authorities generally and social care specifically have come under huge financial pressure over the past years, which is why we have made the argument consistently over the past year for additional investment in social care, above and beyond additional investment in the NHS. And that's so we're delighted to see the announcement in the budget, and the caveat that the Chancellor put around that in his speech was that councils need to take immediate action to fund care packages for more people, support social care providers, and relieve pressure on the NHS locally. And I think that plays well into the partnership work that's been going on through SDPs over the past year, where increasingly health and social care is working very closely together to address these issues. And it's important now that goodwill and that close working now turns into real action for patients.
Joanne.
Matthew, I was concerned by the number of 111 calls that result in an ambulance being dispatched at 13%, and that did seem to me to be exceptionally high. The idea that 1 in 6 person who rings 111 is going to end up in an ambulance, with obvious knock-on effects for other patients who need ambulances and for the congestion that we are seeing in A&E departments. So I wondered if you might tell us a bit more about what you're doing to support 111, both in terms of increasing the clinical expertise in 111, but also, I think at least as importantly, to refine the algorithms using that experience base of 1.3 million calls per month.
No, it's a very good question, and I think over over the next few years, 111 will become an increasingly crucial part of our urgent care offering. At the moment, around 80% of the people who call in to 111 speak to a call handler who is using digital technology to advise them through a pathway and recommends what they should do next. We have committed to increasing the proportion, so that means about 20% of them get to speak to a GP or a nurse, a clinician for advice. We've committed to increasing that proportion to 30%, and then I expect it to rise to 40% and 50% and to much higher numbers, because the evidence shows that that once you have used the technology to stream patients through a call handler, that a significant proportion then, if you actually get to speak to a doctor, they are better at judging risk and better interpreting the person that they're talking to than the IT is. So we have to do two things simultaneously. One is to get the technology enhanced so that as we do more patients, we learn from it, we build the algorithms, and we guide patients to the right place as quickly as possible. And we are moving to make those algorithms available online directly to patients so that they can answer the questions online and get advice and don't have to ring and speak to someone. And during next year, we will be enhancing those algorithms with special protocols for children and for people with mental health problems and for the frail elderly to make them more specific. But we also know that that we should be diverting more people to a telephone conversation with a clinician rather than telling them to go to their GP or go to the A&E department, and that when we do that, more patients can have their problems solved over the telephone. And we will also be investing in the technology over the coming year to make it that for patients who grant permission, the doctor they're speaking to on the phone can see their records and increasingly would be able to write them a prescription if that was appropriate and so on, so that it becomes a more holistic service.
That's really good to hear. And just to perhaps complete that, so do you have a date when you expect online self-assessment to be, if you like, reinstated from the NHS Direct service that was decommissioned with the demise of NHS Direct? So
there will be some dates published in the delivery plan, and I'd hate to spoil the excitement.
Thank you. We look forward to that.
Right, so the answers will all be provided tomorrow, as is always the way. Now, do I have any further questions before I turn to Karen to talk about our corporate performance report? No? Karen, over to you.
This really follows on from what Matthew has said, because both the operational performance in the NHS and everything that we're going to be publishing in the delivery plan tomorrow is underpinned, of course, by the work that's been going on in our national priority programmes. And they've continued to make good progress across many areas, which will be talked about in the plan. But a lot more work that clearly needs to be done, and that's laid out in some granular detail in the delivery plan. So we've obviously, I won't go into a detail on those, but I did just want to say as a result of that thinking around the delivery plan, we've taken the opportunity to think how those programmes need to be supported going forward so that they are more connected to the local delivery in the STPs through the regions, and the programmes are being realigned to that model more clearly and explicitly in many cases. So really that's all I wanted to say at this stage, unless there are any particular questions on either the programme status report or the corporate risks. Malcolm.
Thanks, Karen. Please, anybody take up Karen's invitation? No? Right, well, in which case you've satisfied a